Hello everybody, Andre here.
Rubik here.
Welcome to our December edition of our web series, which is going to be the very last one of the year also. The year has come to an end in a crazy fast fashion, so...
as always.
As always. Today's topic, what are we going to talk about today? In the past month or so, we've seen numerous cases coming through our center that patients from a very mild stress, let it be from a fall, from cough, from bending the wrong way, ended up having very bad fractures of the spine or the hip or the extremities. When that happens, that means your bones are not healthy. Most likely it's what's this called, they have osteoporosis. And we wanted to touch a little bit on osteoporosis today and how you diagnose the test that is done to diagnose osteoporosis. Let's start with Rubik. Explain what an osteoporosis is a little bit, if you don't mind.
Definitely. I'll give you the basics. Basically, osteoporosis is the weakness of the bone, and it gets less, the bones get less dense. It affects all ages. It could be all ages, but mainly people, female after menopause, and it could be men. It affects men also, but Asian and white women are more at high risk than anybody else, any other category or ethnicity. Like Andre said, it can, any kind of movement, any kind of wrong movement, any sneeze, cough, or wrong step can cause a hip or low back fracture if you have osteoporosis. And osteoporosis, when you do the way we diagnose osteoporosis is the scan that we do is called a DEXA or bone density. It's the exact same scan. You can use either one of the names, DEXA or bone density. And when you do bone density, it gives you three results. Either it's normal, or osteopenia, which is borderline to or the beginning of the osteoporosis. And it gives you, and the third one is the actual osteoporosis. It gives you level, it gives you numbers that, based on those numbers, you know where you stand. As you can see on your picture on your screen, the image on the right side is the one that has osteoporosis are present. And when there is spaces in a bone, it's easily breakable. It breaks much easier. And maybe we can have Andre give us more detail to how bone density / DEXA scan is performed.
Sure. Like Rubik said, you'll hear both names interchangeably. Your doctor will order either a DEXA or bone density. They both mean the same thing. The test, the accuracy is very accurate when you do the actual bone density test. You will hear and see there's a couple of portable machines out there where it takes a scan of your heel, but it does not give you an accurate diagnosis.
Yeah, absolutely.
So, and your doctors were very, I'm sure they will be very demanding that you get the accurate actual scan itself. So, a little bit about bone density. Yes, it uses X-rays to obtain images, but it's very, very low energy. To give you an idea as to how low of an X-ray energy it is about 30 bone densities is equal to one dental
which is nothing. Which is basically
X-ray,
nothing.
which is not something for you as a patient to worry about at any age.
You probably lifetime you will not have 30 bone density scans.
Even if you were osteoporosis positive, yes. So a little bit about the test. Time-wise, it takes only 10 to 15 minutes to do the whole exam, and we scan three parts basically. Mainly we do the lower back and the hips, or if the patient has had hip replacements,
bilateral,
you can't accurately because there's screws in there and there's metal in there. Yep. Then we do the forearm. Those are the body parts that are most likely to break when a patient has osteoporosis. Basically, you just lay down on a table and there's a little arm-looking thing that comes over you a few times. You don't have to hold your breath. You don't have to change your position. And most of the time, since it's such a low energy, you'll have the technologist in the room with you. Again, we get almost three diagnoses when we do a DEXA scan. It will either be normal, it will be osteopenia, which is basically in the middle of normal an osteoporosis, and the third diagnosis is that you have osteoporosis. It's recommended that people with osteoporosis follow up on an annual basis to make sure that the treatment that's being done towards your health of your bone is working properly.
And most of the time it's calcium and vitamin D, if I'm not
There's
mistaken.
a couple
yeah.
of, yes. It
It's
depends
up
on
to the
how bad it
doctor.
is.
Yeah,
It could
exactly.
be injections once a month.
Yeah.
It could be tablets, or it could be just regular vitamin D, depending on what your score is. Very often you will hear what's the T score or the Z score. Those are the scores that you get when you do a DEXA exam. Basically, the T score will compare you of a normal patient, or what a normal patient's bone density should be. And the Z score will compare you to somebody of exact your age, exact your height, exact your
Ethnicity.
weight, and see what your number is compared to the other person.
Hence, when we do the scan, before we do the scan, we have to find out about the ethnicity, the
Absolutely.
height, weight, if the patient's smoker, if the patient's taking calcium or vitamin, all those factors, they play a big role on the results of the test. Because if one thing is inaccurate in those stats, then tests can be inaccurate. I mean, the numbers can be completely different. Let's say if the wrong height or weight was entered, or ethnicity was wrong, it can give us a completely wrong diagnosis.
Absolutely.
So that's why we have to get everything very accurate.
So before we wrap it up, just make sure the people in your family, friends, especially elderly women, have had their bone density tests. Otherwise, you can have a very bad consequences when they do fall. And this is pretty much the topic we wanted to cover. Of course, if you have further questions or concerns, you know how to reach us. Drop in a comment, call, or visit our website. Thank you.
And at the end, I just wanted to remind you why me and Andre started this, is because we wanted to educate the public to what to expect when you walk in an imaging center, what to expect for results, and be prepared for, we wanted to prepare you for the test that you're gonna have. And that's it for 2017. And we want to wish you a Happy New Year, Merry Christmas, be healthy, be happy, and
have a great holiday season, everybody. Enjoy the month of December, which is my favorite time of the year. And we'll see you on the other side of the calendar.
there we go. Stay healthy.